This meeting is being recorded.
So welcome back. I wanted to cover today a summary of what's happened since our last meeting, where we are in terms of progress on the goals of this group. I want to cover, first of all, the results of the survey. Thank you for all participating in that. We have the free version of SurveyMonkey, so I can't actually print out the results and share with you. I'll show you on the web now the results. Now, I have to go dive in individually to look at what the individual responses were, but the group responses were good. They showed a lot of variability in what folks are interested in doing, which is good for me in terms of finding help I need on projects. I'm going to summarize several things today and begin having you think about what you want to work on in particular for opportunities. 1 second.
Okay.
First of all, I'm going to focus on the USAID project. Right now, I'm meeting with a couple of leaders of this group. Jen is on now, and my colleague from the School of Social Work, Shiyu. He's helping us to develop a outline, a strategy for writing papers, publishing papers on USAID project. The first one is going to be a concept paper that simply summarizes the entire project, meaning what did we target for USAID, different countries, what's the key problem we're addressing, which is really a combination of integrated health assessment in those countries, provider need for integrated health services, and a patient HRA demonstrating the extent of behavioral health problems for patients with diagnoses of hypertension and type 2 diabetes. So we developed an outline for that paper. We put it into a Google Doc, and I'm going to start populating that with the original research summary. I'll look for any volunteers to help on that paper. I don't need too many. In particular, I'll need some help on a research review for hypertension and diabetes in type 2 diabetes in China, Thailand, Vietnam, and Cambodia. So that paper is one thing, and I'll post, as a next step, I posted just articles. I'll go over that today, research articles. I'll post an updated link for all of you to these different research projects underway. I need to sort those into new folders, but I'll do that next. So watch for that this week. After that concept paper is done, we're going to work on individual country reports, and that'll be based upon which countries are most ready to participate and work with us. I can tell you, for example, Chiang Mai, they want to start working on their data analysis right away. They have 2017, 2018 data. They want to start working on publications for that. So for those who have an interest in Thailand, that'll be an opportunity, okay? Same thing will follow for China, Vietnam, and Cambodia. That's USAID. So watch for a new folder link on all of those projects. Next, we have our research grant writing we're doing now. There's one that's currently in progress of the USAID DIV grant. And this grant, I'll show you briefly now. Hang on for a second while I pull it up. Share my screen here, hang on. So this is a grant for developing an innovative new approach to address a population health problem in a low middle income country. And they have very specific countries that are eligible for this. And they have 4 stages. If you're new, you must apply for stage 1. Proof of concept, that's a total of $200,000. Now the challenge is to do something innovative for that amount of money is difficult because even right from the get-go, ASU takes a certain percentage off the top for overhead expenses, administrative costs. It's typically around 20%. For USAID, research is higher than that. So, oops. So this one will have probably $130,000 to work with. And I'm using the same research team for most of these grants. I mentioned before, it includes in ASU College of Health Solutions, my colleague Matt Gruman, a professor who developed a smartphone app called Be Well 24 for nutrition, physical activity, sedentary behavior, and sleep. And our goal is going to be to, with a research group internationally, adapt that for international use in low middle income countries. The other part of my team includes some colleagues at the National University of Singapore. Singapore is not a low middle income country, or LMIC. However, they have an app developer, a nurse, doctoral nurse who developed a smartphone app. She's testing now for diabetes. That app includes a platform for the clinician and patient to interact, either by audio or video. They also have an AI department, and we're going to use the AI department to develop the app further and apply AI learning, machine learning to the app and later on. So for this, we're going to apply this in Thailand, Vietnam, and Cambodia at minimum. And for stage one, we're simply going to work on, for those 3 countries, defining the extent of the problem for, in this case, type 2 diabetes is our focus, and cover the epidemiology, current treatment as usual for that population, and any research on applying mHealth like we're thinking about for this population. We're going to only in this first stage work on translating the language for the Be Well 24 app into Thai, Vietnamese, Khmer for Cambodia. That's all we can afford to do. We can't afford to actually take the translated materials and load it back into the phone and test it. That would be too expensive because of the cost of app coding and development. We can certainly pull out of the app all the HTML files, hire translators with this budget to translate them. They'll be very straightforward translations in most cases. The one exception is nutrition. And this is, I'm thinking about volunteers from this group. The current app, you might be familiar with the approach called My Plate. It's basically an approach having a visual plate divided into sections. Each section represents a food type, vegetables, protein, etc. It's based upon United States diet. It's been validated for that. That app and the actual language and the coaching built into the app is not going to be the exact same for Thailand, for Vietnam, for Cambodia, because of differences in the nutrition and diet for each of those countries. So I'm going to need help from volunteers from this group to really do a deep dive into nutrition, both how to assess nutrition by self-report and guidelines for improving nutrition, healthier foods that are specific to what's available in each of those countries. So that'll be a key part of this research project I'm looking for help on. All the things I'm covering now in this talk, I'll summarize in writing. I'll just give you a kind of a developing where it is right now. We'll also put in this proposal, we'll talk about stage 2 and stage 3. Stage 2 meaning we'll put the transfer materials back in the app. We'll test the app along with the Fitbit to make sure the interaction works, to combine physical activity monitoring with the self-report measures. And we'll test that and begin a clinical trial in stage 2. And then stage 3 will likely be after the clinical trial is done, using that clinical trial data to apply machine learning. To use machine learning to improve any kind of operation, you need to have many thousands of patient subjects to have enough data to make machine learning useful. So we'll be doing that in the last stage of the project. That's the DIV grant, so I'll post this. This is really written up right now in draft form for our countries. I did some, what we'll be looking at, our partners, things like that. So I'll post this and you'll be able to see this. And I'll begin working on an actual core document soon, looking for volunteers to help on this. I'll work with all of you by email to help sort out interest and assign people to groups to work on different projects. You can be in more than one project if you have time and interest, but do make sure you look at your availability and pick the project. I'll try and scope out the time it takes, what's available, and you can pick to do just one or more than one. It's your call, but don't overreach because I really need help. A lot of it's very time sensitive.
Can I ask a question on this one really quick?
Of course.
This is Jen. Is this similar? It's a different application, but is it similar to the one that we had worked on like last October in like scope? Um, it seems like it was a similar thing with the Be Well 24 app and everything.
Yes.
And oh, go ahead.
No, go ahead. You go. You finish first. Sorry.
Oh no, and I was just gonna say, and as a follow-up question, when is this one due? Sorry if I missed that.
No, this is good. You didn't miss anything. Oops, hang on. Drop something. The approach I'm using, I'm new to doing NIH caliber research. This is going on my third year of applying, and they're very challenging, very competitive. When I first started doing them, I had partners in China doing one project. I had partners in China doing another project, Singapore doing a third. And the challenge is, the way I've been, from my mentors who are successful NIH researchers, the way to be successful, there's 2 or 3 key strategies. First, of course, is excellent writing, and there are tutorials how to do that. Second is having a team that often has to go through multiple applications, getting feedback, written feedback from NIH or whoever they're applying to on how to improve the application, making those changes and reapplying to the same or similar grant. So for me, I've kind of consolidated using a core group, which is ASU Be Well 24, National University of Singapore for their app and AI expertise, and then other low and middle income countries to be the testing grounds. And the reason that LMICs are important is that a lot of the Fogarty International Center grants, which are focused on international research, only approve research in certain countries that meet the LMIC criteria. These are all things I'll get into more detail with subgroups later on. But back to your question, Jen, I'm having this same core group work on multiple grant applications with a little bit different focus. I'll cover that today, for example. So yes, we did a couple in the past on this. I'm working on literally 3 or 4 this year with the same group and a little bit different emphasis, but similar model for each one. So we can take advantage of not starting from scratch for the application. And your second question, this USAID grant is open, but our goal is to apply for this by end of summer, early fall. They have the application in because we don't want to have this be dragging on. And it's a pretty straightforward application. So this will be one of the more high priority ones I work on, looking for help on from this group. Other questions about this grant? Thanks, Jen. Very good. Now this one I'm sharing, I only came across this about a month ago. This is a Fogarty International Center grant. And again, I'll post this for you to see it. This is, as you can see, implementation research for addressing hypertension in LMICs. And this is a UG3 grant, which means they want to emphasize implementation science. How can you take a proven practice, implement it in a place where it's not really available, disseminate it so it's adapted to that particular setting, and make it sustainable. So you have actual buy-in from multiple stakeholders, meaning hospital, university, government, non-governmental organizations, NGOs. So these applications require both a concept, and again, I'll focus on, if we pursue this grant, I think we will, I'll focus on the same approach, Be Well 24 with ASU, National University of Singapore, and 1 or more target countries. We cannot use Thailand because they are not eligible for this, so I'll likely find out if my colleagues in Vietnam or Cambodia are interested in doing this. In both those countries, I have the right contacts to, there's support from university, hospital clinic settings, Ministry of Health, at least in Vietnam from an NGO. So I have the right pieces. This is due July 8th though, so I'll decide this week to go forward or not. If I do go forward, this will be the highest priority help I need to research the countries we choose to submit for this, with hypertension being the key focus, okay? This is to be determined. If I pursue it, I'll decide at the end of this week, and if I do, I'll post and look for help on this one. The final, I'm not going to hold the last one episode, one on adherence, is due in October. It's a NIH application for adherence, and the focus there is how to use innovative approaches to improve adherence and impact the most relevant clinical outcome measures. We're going to do this for type 2 diabetes, and a common problem is you find studies to improve adherence, and they're successful. They measure adherence by either patient self-report, by pill counts, by electronic sensors, Bluetooth and bottle caps, and adherence improves. Maybe other kind of clinical self-report measures improve. However, oftentimes the key clinical measure, whether it's HbA1cs or fasting blood glucose, does not improve significantly. So what's the benefit of adherence improving if you're not improving the actual key outcome measures? So we're going to focus on an approach, again, using People24 along with community health workers. You need to have both in place to impact blood sugar in that population. So that one is not going to be as high a priority. We tried to apply for this, the most recent cycle, and it was due in May. It was just too much. It was too complicated. It's a really big grant. It's a R01, which means it's very comprehensive, very high cost, and needs a great deal of support in writing to be successful. So those cover the things I want to cover for our meeting today. Let me switch gears and go over what I shared in terms of the Dropbox today. I'll do that now. Hang on a second. I've got a million Dropbox files that go back 8 years, so bear with me for a second. Here we go. So I shared this folder, International Research, with all of you, and it contains subfolders. I've had a number of these things organized for a long time. For example, China is very, very deep. All the ones are more recent, Cambodia. I spent time taking folders and moving different places. I also want to thank one of our graduates, Mika Smith. She's a DBH graduate who lives in and works in Israel. She moved there from Arizona when she finished DBH program. And she's interested in getting more involved in international research, and she volunteered to update my research. So some of I've added her more recent Dropboxes. She'll actually be doing updates for me. I'll kind of go over these briefly. Asia Pacific research means I often find articles that cover multiple countries, either South Asia, Southeast Asia. They're more broad studies covering multiple countries. That's what you're going to find in this area. Relatively small file, but this will be growing. These ones say MS. These are files that Mika Smith, MS, helped put together more recent articles. I'll integrate those soon into the actual rest of the file. Cambodia, research on Cambodia. China, general global research. There are many publications that are about global health, World Health Organization, etc. I put those in this folder just for those who want to find big picture articles. This one, for example, the global burden of disease is an excellent one you should all look into. Oop, that's the wrong one. There's a big version of that one. I'll find it later on. But you can just begin tooling around, looking around these, seeing what's in there. I will find a way to systematize how we organize these, develop more subfolders. And once we have students working on, or graduates working on particular projects, they can begin adding new articles they find in a systematic way to this Dropbox. But for now, it's more a way to just kind of tool around and see what's in there, okay? There's some kind of outliers. I'm doing work on stigma for a project in um, Vietnam and Hanoi. I'm consulting with the National Cancer Hospital to develop a psycho-oncology service. So I did some research pulling together stigma articles, both Vietnam and United States best practices in one folder there. That is how this folder is organized. So we'll be adding to this, but it's really a folder you can all use and eventually add to. You all have the ability to edit it. Don't remove anything, and don't change anything without approval from me or whoever I designate later on for a project manager to manage Dropbox. If you're an expert on Dropbox, let me know. I'm not. I've learned to use it by trial and error, and there's still plenty of error involved in my work, so I'll be happy to hear if anyone's expert to helping to organize these. So that's the Dropbox. I'm going to keep on sharing my screen, though, and go over the SurveyMonkey results with you guys. So this is just the aggregate results for you all. Which of the following projects are you interested in? The majority, well, everybody wants to do USAID, which is good. We have plenty of need for that project. A smaller percent, about 30%, are interested in grant writing. A little bit larger percent are interested in the small innovation grants. Now, I didn't mention that today only because I have nothing new. These are the small business grants that are available, and I'm trying to connect with an expert in ASU. They have a department called Office of Knowledge Enterprise Development, and they have an expert on these grants there. I'm going to talk to that person before I unleash us to work on projects. I want to make sure that we have an approach that will meet the criteria for the two types of grants that are offered there. So I'll come back to that later on. Some of the answers for other included providing education, developing curriculum, teaching presenting at conferences, stakeholder engagement, relationship building, project management. Of course, I'm going to need that. And any kind of technical leadership skills. So great to see the diversity of opinions there. Which country? Again, very evenly distributed between different countries. This shows me there's not a strong interest in any one country by most of you, so you'll kind of go where the opportunity is. But there should be plenty of work to go around. We expect to have research papers in play this summer for all these countries on USAID data, so we have plenty of work to go around, as well as having work on some of these countries for grants we're applying to. And again, good news here, domains. Literature review, a lot of folks feel confident in that. Writing a research paper is smaller percent, which is very good because writing is a very important skill for NIH and 4D grant applications. Not surprisingly, a smaller group, but still a substantial group for data analysis and reporting. And then project management, quite a few folks interested in that. I was happy to see that because I need a lot of project management. As these projects all break out into subgroups, I'm going to need to delegate a key person to manage each subgroup in terms of organizing, keeping it moving, communicating with me and other key stakeholders on your work. And last of all, health technologies, about 30% health technology also good. I'm going to be asking people to say, can you find me what's being done for mHealth and AI in Vietnam, in Cambodia? So those kind of folks can help on pulling that together. Or the technical writing for grant applications. Technical writing is very important. I'm not a health technologist. I understand you can pull it together, but I don't understand tech details. If you have that kind of background, I'll be happy to have you plug into some of the grant applications which require very detailed technical sections about whatever applications you're applying. So that covers my agenda for today. Let me stop for a second. For any other things people want to discuss or talk about today. Oh, one more thing. I think I mentioned one of the last meetings, a couple of DBH students are interested in doing work, research in Africa. I have a DBH graduate who is from Zambia. A few years ago, he wanted to do some work with me, trying to reach out to leaders he had connections with and try and establish a project in Zambia. So I connected that student with my colleague. We're going to develop a small group and send an abstract proposal to the government in Zambia. If I get a positive response, I'm not interested in developing a project. I'll look for volunteers for that project also. And that's the whole, I'm spread pretty thin, but trying to find the right interest, looking for grants that fit that country, that'll be a whole other track we can move on in this group. Other of you that have interest in certain countries, if you have resources, contacts, I'm open to that, but it has to be kind of done in a stepwise prioritization way. So questions on anything I covered today, just for a summary, I'll be doing a similar Dropbox with research projects available, then looking for volunteers on different projects and papers within those subfolders, and a way to do project management and tracking these moving forward so we can have steady progress on our most important priorities, as well as anticipating projects down the road in October and beyond. So questions, comments, suggestions, I'm open.
I have something. It's not a question so much as a comment. I was interested in the first project you proposed, the nutrition in various countries, one of which was Thailand. I have a friend who is in a PhD program at another university, and he's doing criminal justice, and his focus is on food justice. Mm-hmm. I don't know if there would be any, if you would have any interest in communicating with him at all, but he is brilliant. And I think that he would probably, if he does have time for this, I think he would probably be valuable.
Yeah, any of you that have any kind of contacts in any of these countries you want to pursue, even if you think you might have a contact, ask your colleagues if they're, of background from these countries. I'll give you an example. I met at a conference years ago, a nutritionist in the VA in Phoenix. I kept in touch with her for about 7 years now. She's willing to help in this kind of project for China. So if your friend, Eric, has knowledge of nutrition in Thailand in terms of the kind of foods, how they're different from Western foods, especially nutrition change, it's different focus from his or her work, but it sounds like if he has that background, I'd be happy to have that person involved if they're interested in volunteering. We have no payment for folks. If they want to volunteer for a piece of the action to be on a grant or be in an authorship, I'll welcome that from many of you. So in this case, I would talk to him as you get more idea about what I'm looking for. Just give him a call and say, hey, we're doing this. Do you have any expertise in these areas? Can you help me out? If you're interested, I'll be happy to invite that person on board to help.
Hi, Dr. O'Donnell.
Hi, how are you doing?
Hi. So it's interesting talking about nutrition because I just was in Uganda for just about 3 weeks doing research in that country with an NGO in Uganda that works with, their mission is resources information to improve health and maternal health outcomes. Mm-hmm. And we traveled around the country and we hosted these like community education events around health and mental health. And it was interesting because one of my colleagues who has her PhD in public health did the plate, right? If you have diabetes, here's a plate, split it down the middle. This half should be all vegetables and greens, and then a quarter of protein, a quarter of carbohydrates, your fruit, right? And so then we had them like, okay, tell us what a meal could look like with your plate, right? What could you cook tonight for dinner that would meet the requirements of your plate? And it was very hard for them to come up with an alternate carbohydrate other than white rice, right? It's like a main staple. It's easy, it's cheap, it's accessible. And they had a really hard time coming up with their vegetables other than, I would liken it to kind of a collard green in the South that they eat. So it was just interesting to look at, what individuals have access to, what they can afford, and what they can consume that's a healthier alternative than, the starches that are easy to afford there.
That's a great example. And that goes back to my point, if we're going to use People24 app, we must do that homework before
right.
we have to build that into the app, right? Because it's not going to be rocket science to find out what kind of vegetable equivalents there are in Thailand, Cambodia, Vietnam. They're going to be different. I look at the fruits and vegetables in Thailand. A lot of them look foreign to me, literally like from a different planet, right? Other ones are very similar. So it has to be built in advance. So that's really, you can't take the Western approach like you did, just roll it out and expect it to be
exactly.
Another common question we found in our USAID research was, what is the portion size? People, what does the portion size mean? And you have to really
Yes.
communicate that, saying, palm of your hand size kind of thing. So great examples of the challenges we're going to face to be more effective in our work developing these things. The more we can address these in a thoughtful, evidence-based way, the more it's going to make our applications stronger compared to this.
Yeah.
A great anecdote. Thank you. I appreciate that. And it's hard work in many respects. I'm not sure the answer myself, but I know just from traveling in China and Thailand, the regional variations are tremendous in the kind of foods that are available and people eat. And a lot of them are unhealthy across the board. So where do you start?
Well, the poverty issue too. I mean, even if you had, a plethora of healthy vegetables, can people afford to purchase them and buy them?
Yep.
And it's not like you can walk into a Vons in Uganda.
Mm-hmm. Other questions or comments? We can wind down for today. I'm not going to go longer than we need to, but we'll meet again in 1 month. I expect to be forming some subgroups on, at least if we go forward with the hypertension grant on that one, and on the USAID DIV grant. Those are going to be two emergent things I'm looking for help on. And don't forget to jump in right away. You can certainly take your time and look for things that are coming down the pike. I'll try and outline what's coming when, what the opportunities are, what the needs are for each one of these. I'm also going to offer some resources to you that can help you improve. If you want to do grant writing, I can offer some resources ASU offers on how to write NIH grants, for example. So I'll try and work with this team to put together both the applications and also supports for how to do a good application for NIH or Fogarty Center. So more to come. Keep the questions coming. Yeah.
Is the so the USAID grant that you want to apply for before fall, that's related to the hypertension issue, correct?
That will be type 2 diabetes.
Diabetes. Okay. So on your work around hypertension, are you connecting that or including any mental health interventions or addressing mental health in any way whatsoever? Is that just solely hypertension?
What we'll do is we're going to build in, we use an HRA in our USAID research. We'll use that or a better equivalent, and we'll measure, at least screen for depression, anxiety, trauma, the most common problems. We're not going to build in this iteration of the app materials to actually guide the patient to self-manage those. It's too much. However, we're launching this app in the context of community health workers, introducing it to the patient, guiding them to use it, and they're responsible for all the patient's care already. So they'll be addressing depression or anxiety based on, hopefully, our information from the app feeding to them, right? We can't build an app with decision support for literally a dozen different lifestyle and behavioral conditions. We can certainly assess them, though, and we assess them over time with the app. That's our goal. And eventually, if we have success, we can then add these later on. But just the complexity of just doing lifestyle alone is daunting for these apps.
Yeah. Yeah. Okay. Thanks.
You're welcome. And just a quick, maybe if we have a few minutes, if folks don't mind, I just see from Jen, Yiting, Karu, and Shiyu, all have international experience or mHealth experience. And if you want to just talk about what you're doing internationally, just to share with the group, and if anybody else online has an international experience, it'd be nice to kind of share some background, get to know each other. So we have a little bit of time. Jen, if you want to talk about your project with T-Mobile in a way that's not going to share anything proprietary, that'd be great. Yiting, you're all over the place with all your products. Karu, you did a lot of work in Asia, and Shiyu is, of course, from China, now working for ASU. If any of you wanted to share some of your thoughts to your folks, what you want to work on, that'd be wonderful to hear.
Yeah, I'm happy to start. So I'm Jen. I'm a DBH student, hopefully graduating next May. I also am a biostatistician by training. I originally got my first master's degree from Texas A&M in biostat and was always interested in healthcare. Through a strange twist of fate, I ended up working at T-Mobile for the last 7.5 years and have found a really interesting application at the intersection of healthcare and technology and sensors. So a lot of what Matt Buman, who Dr. O'Donnell was mentioning, has done with this BeWell 24 app. We are actively working with Dr. Kessler and Dr. Buman and Dr. George Runger from the Biomedical Informatics Department on ways to expand that capability and bring access, better resources, better disease management to people through the advent of 5G. 5G means faster data speed as far as like movement between, and Dr. O'Donnell had talked a little bit about AI and machine learning and everything, and 5G also allows for, because of its ability to enhance data transfer, can also allow for better data aggregation, manipulation, and monitoring. So at a really high level, to not give anything proprietary away, we are actively working on a partnership to do lots of really, really great things in the healthcare space at TMO. And about a year ago, I think, I started working with Dr. O'Donnell specifically on this project because he, on the first iteration of this, kind of group of people who was interested in research, he was looking for somebody to do data analytics. And it seemed like kind of the perfect space for me because I am a statistician and I worked for almost 4 years at Stata, who is a statistical software company. So lots of experience there, and I've gotten to know the data pretty well. Have worked really closely with a lot of the students who have been over there. So while I haven't been on the ground internationally, I've been very close to the data. So that's kind of my area of expertise, my area of interest. And anybody ever wants to talk about nerdy stuff like statistics, I'm your girl. That's always my pitch. So.
One quick comment about that. Thank you, Jen. I'm always thinking how you can find connections and take things somewhere else and enhance your career. So as I was listening to Jen talk, I mentioned that I used to consult for a company in China. They had a big contract with China Mobile, developing training videos for physicians on health techniques. And that might be a place for you to connect Jen to that company if she wants to try and take what she's doing with T-Mobile and apply it to real scale in China Mobile. So this is synergies you can often look for, and think that way in all your projects. How can you find ways to help each other expand what you're doing down the road?
Absolutely.
It's so amazing. When I was in Uganda, you would go into these, we travel into these remote villages with, high poverty, and they all still had cell phones. I was amazed. I was like, oh my gosh, they all have access to a cell phone. So when we were asking around mental health and there was no access to any type of medical center or community health clinic, I would have them download apps around depression or PTSD as like the only thing I could think of to provide, some type of help in that moment, other than brief interventions. And we were only going to be there for 2 or 3 days. But the access to cell phones, like it really.
And imagine when 5G takes off throughout the world, and imagine all the rural places that we can actually impact, not only in the U.S. but in the rest of the world, because of the high speed. There's no data latency. There's no there's no issues with boundaries. Like one tower can actually move data between over 1,000 square miles, and so that's what I'm passionate about. So, but yes, Dr. O'Donnell brings up a very good point. Like always, try to find ways to take your expertise and expand it, and networking is probably the most important thing that all of us can be doing, because you will find really strange ways that your skill set can actually bring a lot of value to a lot of people. So, and I'll get off my soapbox now, sorry.
That's okay.
Hi, this is Shi Wu. I'm the assistant professor at the School of Social Work at ASU. And I'm working with Ron on several projects. One is about we applied a grant to introduce the social worker in integrated healthcare in China. And although I know we didn't get funded, but I think we can still try one more time or try different resource. That's one of my thing that we are working on. And my other research is more about the social determinants of health. And also currently I'm working on a project to develop the substance use prevention in China with the global center at ASU. So it's kind of a lot of connection with China. So if any of you are interested in any project in China, I can help to get connected, or and I also did a lot of stats. So I did a lot of data analysis, work on national data. I personally use EdHealth data a lot. So I use EdHealth data to look at the correlations on the poverty and health outcomes, especially the behavioral health, including depression. So I think that's all about me. Any questions? Glad to meet you,
And Xiaoyu, the grant we did last year is coming up again in October, so we'll definitely apply again with our partner and use the feedback from last time to improve that one. I agree.
Mm-hmm. And I'm also working on, one more thing. I'm also working with Ron and another PhD student, a medical student at the U of A. We are doing a systematic review about the Chinese, the depression in China, especially the intervention on depression in China. So, yeah.
And hi, thank you for that. I'm Karu, and I had the pleasure of being one of the fellows for the GDR, the USAID GDR program last year in Cambodia and in Chiang Mai. And we completed the research, and it was amazing and incredible. And previous to that, I worked in Cambodia at a pediatric hospital. Presently, I moved to New York from ASU. I completed the Master's in Integrated Healthcare, and I was in the inaugural class. And so I am here with my family and am trying to find a new position in healthcare. I'm also a switcher, so I was in supply chain previously and realized that my heart and my passion was in healthcare, and so trying to find a position that would be appropriate to utilize all of my skill sets and keep me interested. So that's me.
One thing I'll say is kind of funny about Karu's work. We had most of our USAID students spend some time in Chiang Mai, and almost all of them have visited there, said, I want to either live there for a while or retire there. It's a very magical place, one of my favorite places to go in Asia. And,
agreed.
Hope you all have a chance to maybe go out there with us and we'll have a meeting there one of these days. Fly out there for a meeting in Chiang Mai.
It'd be great.
So hi everyone, this is Yiting. I think I will go after Karu. I'm also a switcher. I am more on more on the consumer end. I'm a clinical researcher by training, and still involved in research for therapeutic supplement product. And I am also forming 2 different companies right now. One is focusing on device and therapeutic consumer products, and the other one is focusing on more on the skincare therapeutic line. And I just recently came back from Baltimore attending American Society for Nutrition, host the pre-pro and postbiotic seminar for Herbalife Nutrition Institute. And I'm going to Netherlands for SSIB, Ingestive Behavior Society meeting in July, actually.
And you were also just recently in China and South Korea, I
Yeah.
think, right?
Right. Yeah, trying to, set up business.
Well, thanks all for your introduction. Anybody else want to offer anything else from the rest of the folks? Florence, Eric, Jen, any other comments?
I'm sorry, this crew, I know I joined, or I joined late. Did you have any updates on the group that's in Cambodia at the moment? I'm just curious how they're doing.
That person is going to launch to go there in about 1 week. They're delayed because of the ethics committee being slow there.
Okay, right. Not surprising. Okay. Let her know that if she needs any help, I'm happy to provide advice or anything.
I'll do that. Thank you, Karu.
No problem.
Hi, this is Florence.
Hi, Florence.
Yeah, I'm new to the program, and I'm interested in doing some work in Africa. I think I'll be working with Dr. O'Donnell to actually introduce me to a lot of stuff that maybe assess what I am interested in and introduce me to really what my passion would take me to. So I think I will be getting into doing something in Africa, specifically my country, Cameroon, where the healthcare system is really broken. Diabetes is a problem. Mental health issue is a problem. Very limited healthcare clinics, community clinics, very limited workforce capacity. So there's a lot to exploit in sub-Saharan Africa, particularly Cameroon. So I will work especially to improve and narrow down what I really want to do from with the group and with support from the group. I'm actually a DBH student at this time.
Mm-hmm.
Maybe first year, I'm just new in everything.
Thanks, Florence. I also mentioned, Florence, I think you joined a little bit late. I talked about the project working with the DBH graduate. His name is Albert Managua, looking at possible work in Zambia. So you're involved with that project too, and thanks for your help on that.
Okay.
So I'll just share last that I also work at, I'm the field director for the Master of Social Work program and faculty in the social work program at California Baptist University. And so I love writing grants and writing. Those are my two loves. So if I can plug in that way, I would love to do it.
Yay.
You are hands down the first person I've heard say I love and then grant writing. Although I'm usually the only people who hear statistics after I love. So
well, I was happy to hear, Jen, that you like the statistics. So I'm thinking you got the data analysis all day and I'll help with the grants.
That's good.
Hi, just quickly want to introduce myself. My name is Yev, and I come from an IT background. I'm a switcher as well. Healthcare is not new to me. I've been doing healthcare IT and just non-healthcare IT for the past 20 years or so. I do databases, I do various IT stuff, but research overall is just something I'm interested in, and healthcare overall. So I'll be happy to contribute the best I can in anything that I know or don't know. I am learnable, teachable, and I can learn new stuff and help wherever I can.
Thanks, Yev. Well, thanks.
Go ahead. Oh, I was just going to offer my background. It's humble by comparison to many of you, but I've been in college, started my college career in 2012. health sciences. I did my master's degree in science of healthcare delivery in 2016, and I've been in the DBH program ever since. In terms of my background in healthcare, I work at Optum Care, and I know that some of our fellow students are familiar with that organization, but I work with the Medicaid population here in Arizona. I reach out to patients directly, and I try and connect them to resources to kind of elevate their health. And that's kind of the job itself has its pros and cons, really. But the one thing I do love about it is working directly with patients and trying to facilitate, I guess, the improvement of their lives. So that's kind of what I want to do with my future, but working with the underserved specifically. So.
Thank you. Eric, I'm going to share my screen for a second. It reminds me of something, Eric. Hang on one second while I share again. This is a seminar or webinar tomorrow in the afternoon. If I register, this is by Optum Health. Global is local. How does global health impact us? So I'm not going to send you the link, but you can certainly, I can send this the link to the whole group, I guess. It looks like an interesting webinar and kind of coincidental. That's where you work, Eric. So Optum has some great educational programs on disease management, et cetera. So I'm looking forward to this one. All right, folks, thanks for introductions. It's quite an interesting group we have here. Looking forward to bigger and better things as we go forward. The goal being to have this to international conferences. We all get funded and attend across the world to China and Chiang Mai and who knows where else, Africa. So let's think big, but start small with some concrete things we can do between now and next month. Thanks for your help. I'm going to end the meeting now and talk to you soon. Have a good night, all.